Imagine this moment. You've just received a diagnosis that changes everything. Cancer. And just instantly, there's this tidal wave of anxiety, uncertainty, fear. It's overwhelming.
It really is an incredibly isolating feeling. And the first instinct for so many people is, I need answers. I need to understand.
Exactly. So where do they go?
Well, traditionally, and very understandably, they turn straight to the internet.
Yeah.
Forums, maybe social media, just searching online.
Which sounds helpful, but
Right. But the huge challenge there is that the internet is just this vast, often unregulated ocean of information. You find stuff that's incomplete, unreliable, sometimes just plain wrong. And that can actually make the distress worse, not better. People end up feeling even more lost.
it really is like trying to find your way in a wilderness when you're feeling your absolute worst. But maybe there's a glimmer of something new here, a different kind of guide in that wilderness. We're talking about artificial intelligence, specifically things like large language models, ChatGPT. Could they actually be a reliable source, maybe even bring some calm?
That's the fascinating question, isn't it?
Hmm.
And it has potentially huge implications for patient support. So our mission in this deep dive is to really unpack I think, groundbreaking study. It came out of Turkey, and it looked at exactly this. Could a ChatGPT-based digital counseling intervention actually lower anxiety and depression for newly diagnosed cancer patients?
Okay.
So we'll dig into how they did it, what they found, and what it all might mean.
Right. So let's get into the setup. This wasn't just casual observation, it sounds like. It was pretty rigorous.
Oh, absolutely.
Yeah.
This was a prospective randomized controlled trial, very carefully designed. It was run between July and October 2024. Researchers from Gazi University and Etlik City Hospital in Turkey.
Okay.
And they set it up specifically to compare this new AI approach against the standard way patients get information.
And who are the patients involved? What was that group like?
Yeah, they focused on a really specific group, 150 patients who were chemotherapy naive.
Meaning they hadn't started treatment yet.
Exactly. Newly diagnosed with solid tumors. The median age was 64, and just over half, 53.3%, were female. Crucially, they made sure everyone had, sufficient cognitive ability to understand everything and fill out the questionnaires.
Makes sense.
And then they were randomized into two groups.
Okay, two different paths. Let's start with the standard one. What did that look like?
So the standard arm, as they called it, got what you typically expect. Education directly from their oncologist and the chemotherapy nurse.
Mm-hmm.
The usual in-person counseling, the established norm.
You got it, the baseline, and the other path, the ChatGPT arm.
Right, so they got that standard care too. But in addition, they had this new tool. They could submit up to 10 questions to the ChatGPT 4.0 model.
10 questions about anything cancer-related.
Pretty much. Treatment specifics, prognosis worries, side effects, whatever was on their mind regarding their diagnosis or care.
Now, what I found really interesting here, and maybe crucial, was the human element. It wasn't just AI running wild, was it?
No, absolutely not. And this is, I think, a huge strength of the study design. Two oncologists, actual doctors, meticulously reviewed every single response that ChatGPT generated.
Every single one.
Every one. They classified it as either appropriate, inappropriate, or unreliable. And if it was inappropriate or unreliable, they stepped in and provided corrected, accurate information directly to the patient.
Wow. So a built-in safety net. They were testing the AI, but ensuring patient safety above all.
Precisely. Human oversight was absolutely paramount.
Okay, so they've got the setup, the two groups, the AI with oversight. How did they actually measure if it was making a difference? How did they track anxiety and depression?
They used a well-known tool called the Hospital Anxiety and Depression Scale, the HADS scale.
Right.
Scores were taken at the beginning, before any intervention, and then again just before the patient started their second cycle of chemotherapy. The key thing they were looking at was the change in those HADS scores over that period.
Okay, makes sense. So meticulous setup, clear measurement. What happened? What did the results actually show?
Well, the findings were quite striking, actually. Really significant. The headline result, the ChatGPT group had significantly lower median anxiety scores at that follow-up point. Their score was 6 compared to 8 in the standard care group.
Lower anxiety and depression.
Same story. Significantly lower median depression scores, too. 6 for the ChatGPT group compared to 9 for the control group.
9. Wow. So clear differences.
Yes, and statistically significant differences, not just small variations.
That contrast is pretty stark, isn't it? The control group scores compared to the ChatGPT group.
It really is, because while the ChatGPT group's anxiety scores actually went down significantly,
Uh-huh.
the control group saw significant increases in both their anxiety and their depression scores.
So the standard approach wasn't enough to stop distress from rising as treatment got closer.
That's what it suggests, that without this extra accessible information resource, the psychological burden tends to naturally increase as patients approach that second chemo cycle.
So ChatGPT wasn't just helping a bit. It seemed to be actively pushing back against that rising tide of distress. And it was a major factor for anxiety.
The strongest factor, according to their analysis, using ChatGPT was identified as the strongest predictor of anxiety reduction. They calculated an odds ratio of 18.684.
18.6. What does that mean in practical terms?
It means patients using ChatGPT were almost 19 times more likely to see their anxiety decrease compared to the control group. That's a huge effect.
19 times. Wow. Okay. And for depression?
For depression, ChatGPT use was also a significant predictor, but interestingly, so was having postgraduate education.
Ah. So higher education also played a role in lowering depression scores.
Yes, which kind of raises an interesting side point, doesn't it?
Yeah.
About how maybe education level influences how people cope or process this kind of difficult information.
Definitely something to think about. So stepping back from the scores for a second, what's the bigger picture here? What does this tell us?
I think it strongly suggests that giving patients access to this kind of AI-driven, but importantly, expert-reviewed information can make a real dent in the psychological weight of a cancer diagnosis. It's like
Yeah.
that information void isn't just about facts. It's a space where fear and anxiety can really grow.
Right.
And this tool seems to help fill that void, maybe giving patients back a little bit of control or understanding, which is so important when you feel so vulnerable.
Beyond just the scores, though, I'm really curious about how people used it. Did they
Wow.
ask things they wouldn't normally ask their doctor?
Yes. And this is where it gets really fascinating, I think. It uncovered some, let's call them hidden needs. The study found patients used ChatGPT to ask things they might have felt, awkward or maybe embarrassed to bring up face to face.
Like what?
Well, for instance, 27% more than a quarter of the ChatGPT group asked about sexual health.
Okay.
And 30% asked about things like herbal supplements or vitamins.
Things that maybe don't always come up in a busy clinic appointment?
Exactly. Topics that are often kind of pushed aside in standard time-limited consultations. It really highlights the need for a private, maybe less intimidating space for those kinds of personal questions.
That's a powerful insight. And did they keep using it? Was it something they engaged with outside the study appointments?
They did. The researchers noted that about 30% of the patients in that ChatGPT arm continued using the platform at home between their chemo cycles.
So it wasn't just a one-off thing for the study. It had real-world usefulness for them.
Seems like it. It shows it was providing ongoing value, kind of extending that support beyond the clinic walls.
Okay, so it clearly had an impact on patients. They used it for sensitive topics. They kept using it. How did the AI itself actually perform? What was the accuracy like?
Overall, pretty good, actually. A high success rate. They found 88.5% of all the questions, and there were 750 inquiries in total got an appropriate response.
88.5% is quite high for a general AI in a specific medical context.
It is impressive. But, and this is important, it wasn't perfect.
Right. Where did it fall short? What were the problem areas?
There were specific areas where it was less reliable. Dietary advice, for example. About a 20% error rate there.
Why was that?
Often the advice was too general. It didn't always account for, say, specific dietary restrictions needed because of the chemo or individual patient factors.
Okay. And any other areas?
Yes. A more concerning one was sexual health guidance. That was rated unreliable in 60% of cases.
60%. That's high. What was missing?
Critical details, things like the risk of bleeding, potential fertility issues related to treatment, or even how medication might be excreted in bodily fluids, which could affect a partner. Really important safety information was sometimes absent.
And that just circles right back to what you said earlier about the human oversight, doesn't it?
Absolutely. It powerfully underscores why expert clinical review is non-negotiable when using AI for health information. AI can process data, it can generate text, but that nuanced medical judgment, especially for complex or sensitive areas needing personalized assessment, that still requires a human expert.
So, connecting all these dots then, How should we view AI like ChatGPT in healthcare based on this? Where does it fit?
The study's conclusion, and I think it's the right one, is that these tools are valuable adjuncts. They're additions or maybe alternatives to traditional psychosocial support.
Adjuncts, not replacements.
Exactly. They complement the human interaction, the empathy from doctors and nurses. They don't replace it.
And why does it seem to work so well psychologically beyond just delivering facts?
Well, the study points to a couple of things. One is that online systems feel less intimidating for some people.
Right, the privacy aspect we talked about.
Yes, you can ask questions without feeling rushed or judged. And also, ChatGPT can generate responses that sound quite empathetic. That feeling of being heard and understood, even by an AI, can be surprisingly powerful.
Mm. And compared to just Googling or going on social media.
Oh, it's a world of difference. Unlike the sort of wild west of the internet where, popularity or clicks often matter more than accuracy,
Yeah.
an AI like ChatGPT, especially within this kind of controlled system, can give more personalized, direct answers. It's generally more reliable and relevant to the specific question asked.
It definitely sounds incredibly promising, a new way to offer support. But we have to talk about the limitations too, right? What are the inherent boundaries here?
For sure. ChatGPT, even the advanced versions, has clear limits. It doesn't know a patient's specific medical history unless it's told. It can't do a physical exam. It can't order or interpret diagnostic tests.
Obvious but important to state.
Very important. And its training data, while huge, might lag behind the very latest medical guidelines or research findings.
Which again emphasizes the need for that expert oversight.
Always. It's critical for safe and appropriate use in any clinical setting.
So looking ahead, how could this be improved? How do we make AI even more reliable for patients?
Well, one potential path forward is building interfaces that allow these AI models to securely access and incorporate trusted, up-to-date guidelines, for major organizations like ESMO or ASCO.
So feed it the gold standard evidence-based information directly.
Essentially, yes.
Yeah.
That could significantly boost its reliability and clinical relevance for patient questions.
So thinking about the big picture impact of this study, even considering its own limits, like maybe the self-reported answers or the relatively short follow-up time, it really feels like a potential game changer, doesn't it?
I think it absolutely is. It really paves the way for understanding how AI can genuinely help ease that huge psychosocial burden that comes with a cancer diagnosis. It gives us a glimpse of a powerful new tool, one that can deliver empathy and information in a really accessible format, potentially reshaping the patient experience during such a tough time.
What an eye-opening deep dive this has been. So just to recap the core idea, we've seen some really compelling evidence that a digital tool like ChatGPT, when used carefully with human oversight, can be a significant help. It can actually reduce anxiety and depression for people facing a new cancer diagnosis.
It's a really profound demonstration, I think, how technology, when we integrate it thoughtfully, can genuinely improve well-being. It addresses not just the need for information, but also that deep emotional distress that illness brings.
So it leaves us with a big question to ponder, doesn't it? As these AI tools like ChatGPT inevitably get more sophisticated, more integrated into healthcare, how might our whole idea of patient education change? What new possibilities open up for really personalized, accessible support that manages not just the physical side, but mental well-being too?